मेंबर्स नहीं आई गेस इस पे अभी। हाँ, ये मैसेज ड्रॉप कर दो। Hi, good evening, everyone. So, am I audible? So, any one of you, please just write yes, and then I think we can start. Okay. So, sorry for the glitch. So, basically, there was a technical issue, so we couldn't start it earlier. So, today we are going to discuss about asthma and allergy management in winters. So, as we all know, the asthmatics always face the issue that their symptoms are not well controlled when this season changes and when the cold weather comes over. Asthma management is a bit tricky and it needs a close observation during the winter season. As asthma is of many types, so many pollens are also common in this season, and a few patients suffer symptoms because of that. In basic asthma management, the first I'll brief you about the basic things, and then I think we can take it further that what specific thing needs to be done in the winters. So asthma is inflammatory disease where your lung pipes are getting inflamed, and this might be there might be some reasons like some allergens are there, some pollen allergy, some particular food allergy, or sometimes a non-allergic asthma can also be there. Asthma can generally start from childhood and even the late onset asthma, like in adults also the asthma can come. So now once you are being having symptoms of asthma like fever, cough, breathlessness, chest tightness, wheezing, and frequent sneezing. Even along with asthma, sometimes the rhinitis symptoms means the nasal symptoms are also there, where patients started having running nose, nasal blockages, and sometimes even the throat is also getting involved. So, first point to check the treatment of asthma is first thing is to diagnose it, whether you are having asthma or you are having some other issue which mimics like asthma. So to diagnose the asthma, one is the clinical history, which is very important, and along with that, the lung function test. So the pulmonary function test is the one of the important tools with which we can diagnose asthma. Once we have diagnosed it, now how to treat it. So the ideal therapy for asthma is inhalers. So inhalers, we start with the inhaled steroid. Inhaled steroid is the basic of the therapy of asthma, and that needs to be taken. Dosage and how frequently, all those depends upon the patient's condition. Some patients just need the inhalers during the particular season when their symptoms are more, just like in winters. But many patients, they don't get the relief whole year, and they might need the inhalers round the year. So the basis of asthma treatment is because there is inflammation in your lungs, so give anti-inflammatory means steroids. Along with that, give some bronchodilators. These are also in the inhaled form. And various combinations of shorter acting, longer acting can be used, and we can control your symptoms. But sometimes, even if the inhaled drugs at higher dosage, when the symptoms are not being controlled on that, so then we have to give some oral medications also. So now, as we have just briefed about the basics, the specifics about the winters. As winter comes, there is a cold air, and many patients have triggers because of the cold air, and they can get the exacerbation or increase in symptoms when winter comes. So, and in this time, because the pollution level is also quite high, so further it irritates your lungs, and you can get the symptoms. Now, how to treat about it? So, one more important factor which I would like to add before going into specific in the winters, that peak flow meter is a device which every asthmatic should be having, and this is nothing but every day you check your expiratory air, how much you can expire after a full inspiration, and this value can guide you earlier, that whether your symptoms are going to worsen in the recent future or not. So before every asthma attack, generally before 1 to 2 days, your symptoms will be more, and you will see that your peak flow meter values will start decreasing before your symptoms arise. So that is one important thing which you should keep in mind, and you should have that device. Along with that, you should have a written asthma plan always with you, and in that plan, basically, your doctor and you will decide what medications need to be given in case of emergency, and what symptoms you have to talk to your doctor or just have to increase your medication. Now in winters, as the triggering agent comes, like the cold exposure, the pollution, sometimes particular allergens, so all these will aggravate your symptoms. So you should talk to your doctors if your symptoms start increasing, even on your regular medications. Sometimes, if we increase the medication right on time, so generally we can prevent the hospital admissions and we can control your symptoms. But if in the rare scenario, if you don't talk to your doctor early and your symptoms worsen a lot, so you might need a hospitalization. Few important points to raise here are that what are the warning signs where you should not wait at home and you should just rush to the hospital. This is if you're too breathlessness, if you're having too much breathlessness even after getting the inhalers and you are not able to speak a complete sentence. If you have a pulse oximeter, so if your oxygen level starts falling anything below 95, so it means there is a severe asthma attack and you should rush to the hospital. If the patient is becoming drowsy, it means again it is also a warning sign. If your breathing is too labored and you're getting too tired just by sitting and breathing, so in that condition also you should rush to the hospital. A few important precautionary measures which can be taken are: few are vaccinations like influenza vaccinations, pneumococcal vaccinations. These are routine vaccinations which a asthmatic should always have. And if they are taking it, so these common infections can be prevented, and at least their serious forms of the infections can be prevented. Take your inhalers regularly, and before this season you should meet your doctor and get a proper asthma written plan on which you can act, and you will have the knowledge that these are the warning signs which will warrant that we have to rush to the hospital or talk to your doctor. Along with that, your technique. Most of the asthmatics, when they say that my symptoms are not well controlled, so first issue comes that the way you are taking your inhaler is not right. So in every visit, just show your doctor how you are taking the inhalers, because if your technique is not right and inhalers, the medicine is not going properly inside, you won't get the desired benefits. So first thing is technique of the inhaler. So then second comes compliance. Many patients generally, when they feel that now I am not having any symptoms, so then they will start using the inhalers as per their convenience. Like if we have written twice a day, so they will start using once a day, and if symptoms arise, then they start using it. That is also not the right way, because in that way, if you are taking once a day only and the medication was prescribed for twice a day, so then half of the day you are without any medication and your lungs are getting the injury because of that. Along with that, we have to look for the other comorbidities. If your asthma is not even controlled with these basic asthma treatment, and few comorbidities, one is I would like to emphasize is obesity. In morbidly obese patients, the symptoms are generally not well controlled, because sometimes they might be having additional sleep apnea symptoms or a sleep apnea disorder, which is further aggravating your symptoms. Sometimes patients are having allergic rhinitis, and if that is not treated properly, so only the asthma treatment won't relieve your breathlessness. Sometimes patients of severe gastritis, they might have acid reflux disease, and in that condition also, if you're not going to treat that, the symptoms of the asthma won't be completely cured. So few things, and along with that, you have to look for the trigger, because if you know that this is a triggering agent for your asthma, just like I know that if I am particularly allergic to some particular allergen, I should avoid the exposure of that. Like if I know that cold air exposure causes my symptoms to worsen, so I should avoid going into the cold environment, at least, like unless it is an emergency. And even if we have to go out, so then use some mask or something which, so that you don't get the direct cold exposure. So these are the few things which we can do, and we can control the asthma symptoms, and we can live a healthy life during the winter months also. Because if you are taking your inhalers regularly and all the medications which your doctors have prescribed, so most likely with the modification of the medication, your symptoms will be well controlled and you can go normally. Another important point to raise here is workout in winters. As we know that workout is necessary for a healthy lifestyle, but the problem is during the winters, at least in Delhi and in northern part of the India, the pollution levels are quite high. Now, because this pollution is high, so in place of benefit of getting benefit of exercise, you will get more harm because of the exercise in outdoors, because the pollution level is so high that you will cause more damage to your lungs compared to any benefit of the exercise which you will be getting. So now, how to prevent that damage because of exercise and because of this pollution in the winter? So avoid doing workouts when the pollution level is quite high. So keep a check on your pollution level of your area, and if it is in the higher category or severe category, don't go out for workouts. That is one. And even if now levels are a little better, but still the pollution is high, so what time? Another question comes that, should I go in the morning? Should I go in the evening? Ideal scenario, morning and evening, when the temperature levels are low, the smog is near the earth surface, and the pollution level will be high at that time. So avoid working out during the extremes of the time, like early morning and the late evenings. So afternoon, when the weather is little hot and the pollution level is little less, that time you can do the basic workout outside. Avoid doing any workout, but still I would say avoid doing any workout when the level is very severe. That is one. Eat healthy dieting. Along with that, stay indoors. Now another question comes of air purifiers. Now, air purifier is quite a controversial subject, but it has been seen that in asthmatics or any patients with chronic disease, if they are using air purifier at their home, so then they will be benefited from the harmful effect of the pollution. But in normal healthy adults, if you'll ask whether there is any benefit of air purifiers, so that is not proven medically. Although we imply that even if, like, if patients are getting benefits, so healthy adults will also get benefit. So air purifiers can be placed at your bedroom, and at least 8 to 10 hours you can have a quite a fresh air, I would say, that pollution free air, and you can prevent getting the symptoms. So with this I would like to conclude that asthma can be controlled well even during the winter months. And if you are taking your inhalers regularly, you have a proper written asthma plan with your doctors, that what all medications needs to be taken and when, so then you can control your asthma well and you can live a healthy life. Along with that, have these vaccinations like influenza, pneumococcal on time, not during when the symptoms or like any asthma exacerbation is there or asthma attack is there. At that time it should not be taken, but generally you should take these vaccinations, and you can prevent serious side effects of these infections, which can be prevented by just taking vaccination. So stay healthy, do regular workout, avoid the workout during the extremes of weather and during the high pollution time, and live a healthy life. So with that, I would like to conclude, and I would request you guys to please share any of your questions, and I would be happy to answer all those. Thank you. So if any questions, so you guys can write on the chat box. So there is a question that by Miss Indu that there is any specific diet in asthma patient. So diet is quite variable in asthma patient. So why I am saying that, generally any food can be taken by an asthmatic, but sometimes in asthma there can be a food allergy along with the asthma. So if a person is allergic to a particular food, only that food needs to be avoided. Nothing specific that he should not take. So he can take anything. So there is another question that all the time the patient is having mucus coming out. So that is one. So uh, phlegm can be a symptom of many diseases, and if you are asking about specifically the asthma, so phlegm is a sign that there is still an inflammation inside your lungs and they are not completely well controlled with the asthma medication, and you need further investigation and the modification of the treatment. Another question is, I am particularly impacted when it's severe AQI. What do you suggest? So, in specifically answer to this is, in asthmatics, avoid doing the workout during the higher AQI levels and put a air purifier in your bedroom, and that will help you out. And modify your medication, modify the medication with your doctor, and that will also help you out. So there is a question by Mr. Mayank that can we stop asthma medication? So it depends upon the severity of the asthma and type of asthma. Because in mild asthma, generally the treatment they require is SOS only, and maybe in sometimes some types of asthma they are like in particular seasons. Like few patients are allergic to a particular pollen. Like sometimes these pollens are in the uh, winter months, sometimes like in the rainy season. So in that particular time the patient needs treatment, and otherwise he don't need it. Another answer to this, that whether the asthma medications can be stopped in severe cases of asthma when the treatment level is going quite high. So there is a role of immunotherapy if we can specifically find out any allergen, and against that, when if you have proven it by the skin prick testing, so against that if we give a immunotherapy, so in some cases, in 30-40% of the cases, the asthma treatment can be stopped even in the severe cases. Any other question, please? So if there are no more questions, so I think then we can conclude this. So thank you everyone for coming and listening to me, and sorry for the technical glitch. So we could join little late because there was some laptop issue. So yeah, so another question is, just today got discharged from Medanta Hospital. They told bronchial asthma, airway hyperreactive. Yes, so you might be having the asthma, acute asthma attack, and that's why you landed into the hospital. So your doctor might have given you the regular medication. Just follow that schedule and go to the regular follow, because what happens sometimes, once your asthma gets properly controlled on medication, so then the patient feels, now I'm fine and I can stop the medication on my own. There is a way and time to stop the medication, and if you are using that, if you are following your doctor's advice, so yes, then gradually we will reduce your medications. Right now you might be on a higher dosage of everything. Gradually we will taper it down and see what is the minimum basic dose on which you will be remaining stable. As we have mentioned some medications, yes, so medications are looking perfectly fine, and continue using that, and take a regular follow up, and whenever your doctor has asked you to come, so just be there. Another question by Miss Indo is asthma genetic? Yes, asthma runs in families also, not always, but yes, it runs in families. So patient will tell us that my grandmother or my mother or my uncle was having asthma, and now I am also having these symptoms. So yes, it runs in families too. Any other questions, please? So if there are no more questions, so I think then we can conclude the session. Thank you guys. And on this group, we will keep on sending the links for the various talks, and you can also ask any questions through that group channel, and I'll be happy to answer all those and solve your queries. So if you want to take my consultation, so I am mainly based at Apollo Spectra, Chirag Enclave, New Delhi, every day. So there also you can avail my services, and through that WhatsApp channel you can ask any queries which are related to your disease, and I'll be happy to answer that. So with that, I am concluding this session. Thank you very much for coming over, and good night.